This week, the White House announced a plan for a COVID-19 booster shot. That means if you have received the Pfizer or Moderna vaccine, you would be eligible for the booster 8 months after your second dose. These could roll out as soon as next month, pending CDC and FDA approval. But what about the millions of people who received the Johnson & Johnson shot? Will you need a booster? Are you concerned about waning immunity? 10 Tampa Bay reporter Liz Crawford has some clarity for us.
If you got the J&J jab, the most important thing?
I want people to know that their vaccines are still efficacious. They're still working.
All 3 vaccines in the U.S. are still doing their job of preventing hospitalizations and deaths from COVID-19. When it comes to a booster for Johnson & Johnson, it's a little complicated because their vaccine uses different technology.
The Johnson & Johnson is a virus within a virus. They both can trigger an immune response.
Here's a sketch. Dr. Roberts says J&J puts a tiny piece of the coronavirus inside an adenovirus, which acts as a carrier into the body. Your body creates immunity to both viruses.
In the past, adenovirus vaccines have suffered from this, in that the booster shots were problematic because you got a massive immune response to that carrier.
She says we need more data to study if boosters will work. In the meantime, mixing and matching isn't out of the question.
If an individual is concerned, number one, you have to talk to your healthcare provider so they know your exact situation. And then number 2, yes, you can get boosted with a different shot if you need to.
J&J recipients should know that there is some real-world data showing the Johnson & Johnson shot is holding up against the Delta variant. When it comes to vaccines, Florida has just over 50% of the population vaccinated, ranked 22nd in the U.S. The nation did hit 1 million vaccine doses administered yesterday for the first time in nearly 2 months.